Hello everyone and welcome to another episode of Ask Dr. Bob, and this is a special Thanksgiving Ask Dr. Bob. We appreciate all of you who watch us around the world and forward this on to your friends and family, and we just appreciate it and thank you for being a part of our lives. Several really good questions today. Dr. Bob, I've had bad breath my whole life and lots of moles. Well, I want you to know, it seems like anytime you watch something on television, they're talking about bad breath and chewing gum and bad breath. Watch this here. Your stomach is right here, and there's a big pipe that comes out of your stomach called the esophagus that comes right out of your mouth. If you are combining food improperly, what does that mean? Steak needs an acid pH. Starch, like potato or pasta, is alkaline. When you mix the two together, that can cause digestive distress in some individuals, especially if you're blood type A. Didn't really mention your age, but I oftentimes will see individuals over 40 years old have more challenges with bad breath because they have less digestive enzymes. It's very possible that you just have poor digestive health. What blood type are you? Blood type A, have digestive distress. You may consider a digestive enzyme. Lots of moles would be a body signal to me that you have liver distress. See, moles are a body signal that your liver is trying to do whatever it can to help support optimal skin function. Dr. Bob, my husband has a really bad shoulder. It hurts him all the time that he's in tears. All they want to do is rehab to him. They told him that he had bursitis. If I have somebody that comes into our practice and they have pain that severe, we would do a drop arm test to him. See if your husband can hold his arm up, and if it drops down, it may suggest that he actually has a tear. Now, I'm not trying to replace a visit to a healthcare provider. I would encourage you to possibly have an MRI to rule out a tear, because tears would cause that relentless pain. Dr. Bob, I've followed your videos for years, and I've been bleeding for 3 years, and I finally figured out it is all the soy I've been putting in my body. So I stopped doing the soy and the bleeding stopped, and then it started again when I started a product called Medifast. When I went to see the healthcare provider, they asked me what I was using for birth control. I need help. How can I cleanse my liver? I weigh 250 pounds. Well, there's a product that we use called calcium D-glucarate. Calcium D-glucarate helps support optimal liver function. And I think that's really important. Anytime we see somebody that has an estrogen imbalance, we always think too many challenges with the liver. Avoid soy, avoid canned food. You want to purify your system all the way around the best that you possibly can. Finally, somebody asked me a question about steroids. Dr. Bob, I'm going to buy legal steroids. What do you think about pro hormones? They were talking about a website where they could get these legal steroids. Here's what I want you to understand. Anytime you put a steroid in your body, it's going to confuse your body. I would much rather have you focus on improving adrenal gland function. Adrenal gland function is going to improve your male hormones if you happen to be a male, which I am assuming that you are. Tribulus is an herb that you could use, and so with maca root. I would avoid all soy, because soy is going to be contrary to making testosterone hormone. So you could have your adrenal glands tested by a saliva test. You could also just check by having your blood pressure taken from a sit to a stand position. Let's say that at a sitting position it's 120/80 and you stand up and it drops down, a body signal to me that you have adrenal gland dysfunction. I want to go back and recap a moment. Bad breath, think about food combining. Do you have moles? Work on assisting liver function. Eat Dr. Bob's ABCs, half a red apple every day, 1/3 cup of beet fiber, and 1 medium carrot. Have that shoulder MRI. That'll be a great opportunity and a great way for you to find out exactly what's going on inside of your body. Happy Thanksgiving. Thank you for watching us each and every week. Please pass this on, and we just look forward to working with you over the rest of the holiday season.